to this sub-plenary session on mental health promotion policy. In this session, we're going to discuss transformative practices, advocacy and capacity development. And this session is being brought to you by the IUHPE Global Working Group on Mental Health Promotion. So let me just introduce the panel to you. Okay, so my name is Margaret and I am the chair of the Global Working Group, and I am delighted to be joined today by other members of the group. I would like to introduce Dr. Miranda Novak, who is from the University of Zagreb in Croatia, and Miranda is online. Dr. Emily Jenkins from the University of British Columbia in Canada. Our colleague Juliana Fleury from ASEC Brazil, Child and Adolescent Mental Health Promotion Association, who I hope will be with us shortly. We'd also be joined by our colleague Irene Verins from the Wellness and Prevention Programme at Beyondblue in Australia, and by Dr. Janet Fanslow from the University of Auckland in New Zealand. Now, our two colleagues from Australia and New Zealand will be presenting their presentations are pre-recorded because it's the middle of the night for them, but the rest of us are here. And so we'll make our presentations, and then we will have a opportunity for discussion and questions and answers. So please just use the Q&A function, any comments, and just engage with us because we're really keen to get feedback. So this particular sub-plenary, our aim is to advance thinking on transformative policies and practices for promoting population mental health, well-being and equity, so that we can respond in new and better ways to promote mental health. The key themes that we will be addressing in this sub-plenary are, first, the need for transformative upstream policies and approaches so that we can address the structural determinants of population mental health and reduce inequities. Secondly, we want to look at innovations in policy development that can demonstrate particularly how marginalized communities and population groups can be engaged in more responsive policy development. And thirdly, we want to look at the need for investment in mental health promotion to ensure that good practices can be scaled up to benefit more people globally. Now, I'm going to start by giving a brief overview on population mental health and the particular approach that we take. Then following that, Miranda will address the issue of advocacy for global mental health. Followed by Emily, who will then look at a particular aspect of policy advocacy, particularly working with priority groups. Juliana will provide a perspective on strengthening investment in mental health promotion in South America. Irene Verins will then talk about developing a well-being strategy and communities of practice for population mental health. And then lastly, Janet will speak to capacity development for mental health promotion. And then each of us will speak for about 10 minutes. And then following that, we can have our open discussion section. Okay, so let me start. I'm based at the National University of Ireland in Galway, where I direct the WHO Collaborating Centre for Health Promotion Research. I am the outgoing president of IUHPE, and as I mentioned, chair of our Global Working Group, which was established in July 2020. And we have been a very active group and have engaged very well, in fact, over the last couple of years. So further details on the IUHPE website. So let me just start then by saying that I think in the last 20 years, particularly, we have seen a much greater understanding of the fact that mental health is an integral component of health, well-being and sustainable development, as highlighted in the WHO Global Action Plan and also in the UN Sustainable Development Goals. For the first time, promoting mental health and well-being is explicitly referenced under Goal 3. And so we understand mental health to be really central to ensuring healthy lives and well-being for all at all ages. Promoting mental health, I think, again, we can see that it contributes not only to the functioning of individuals, but very much to the functioning of families, to communities, and indeed the social and economic prosperity of society. I mean, we saw during the pandemic the need really to respond to mental health challenges in new ways, that we saw how the pandemic exacerbated existing inequities for many groups, people with existing mental health conditions living in poor social and economic conditions, and mental health was really impacted at a universal level. So we really need to move beyond individual-oriented treatment approaches to make sure that we have a population-based strategies to address the mental health needs of the whole population. So this is in fact very much the approach that we've been advocated by WHO since 2002, where they said we need a comprehensive public health approach to mental health, embracing promotion and prevention alongside treatment and recovery. And that is very much the approach that we are taking here, focusing on the promotion aspect of this. Our understanding of mental health has also deepened and widened, I think, in recent years. And we've very much conceptualized mental health as a positive resource for living that enables people to live their lives successfully. So you can see in this WHO definition, we define mental health as a state of emotional and social well-being in which the individual realizes his or her abilities, can manage the normal stresses of life, can work effectively, and can play a role in one's community. And alongside that kind of better understanding and broader understanding of positive mental health, we have seen the development of mental health promotion as a multidisciplinary area of practice and of research, underpinned by the same fundamental principles as health promotion. And this definition here says that mental health promotion is concerned with strengthening protective factors for good mental health and enabling access to the skills, the resources, and the supportive environments that enhance equity and keep individuals and populations mentally healthy. You might be able to make out there in the figure that we see that mental health promotion sits alongside prevention, treatment, and recovery, and that mental health promotion is dealing, in fact, with the whole population. And if you're interested in finding out more about the implementation of mental health promotion in practice and the evidence underpinning that, I invite you to consult the Implementing Mental Health Promotion textbook that we produced in 2019, published by Springer. So over the last 30 years, we have also seen that the evidence base for mental health promotion has been strengthened considerably, and that we now have fairly compelling evidence base that the promotion of mental health leads not only to lasting benefits for mental health, but to improved benefits for health and social well-being of individuals, their families, and of society. So there's quite a significant impact. So building on that evidence base, we adopt a life course approach when we look at these effective interventions that they cut across the life course, starting from infancy and going right up to older age. We also adopt a settings approach. So we look at actions that can be delivered in the everyday settings or contexts where people live their lives using different delivery platforms. And we also adopted a determinants of mental health approach, which seeks to address the wider social and structural determinants of mental health in order to reduce inequities. So we now have a kind of, a base of interventions that have been developed based on strong evidence that can be feasibly implemented in terms of cultural appropriateness and capacity to be delivered within existing systems. I think that's quite important, that we can embed mental health promotion within existing systems. And drawing on the series of evidence synthesis and briefings that have been prepared for WHO, government agencies across high, middle and low income countries. It is true that most of the evidence is coming from high income countries, but we're also seeing a good emerging evidence from low and middle income countries as well. Drawing on that evidence base, our global working group produced a position statement on critical actions for mental health promotion in 2021, and this effort was led by Jenkins. And in that, we really draw attention to the need to invest in mental health promotion and identify 8 priority areas based on the evidence, which essentially looks at how we can integrate mental health promotion, starting prenatally, working in the early years, going up the life course to looking at embedding it within a whole school approach, then moving workplace settings where we spend a lot of time, also within community empowerment programs to make sure that we reach the most marginalized groups, incorporating mental health promotion also within our standard health services, primary care particularly, and also our other treatment services, enhancing public awareness of the importance of promoting mental health and how that can be done, and reducing stigma. And lastly, then ensuring that we have a kind of mental health in all policies approach, so whole of government, whole of society approach to promoting population level mental health. So I encourage you to go and look at the statement where you can find it there. There is the web link on the IUHPE website. So, drawing on this session here, we're going to focus on advocacy in order to build on the strong scientific, social and economic case, because we know that there is a good social investment and a good economic return on investing in mental health promotion, particularly in the early years. And looking at the case for a sustained policy focus on the delivery of high quality, comprehensive mental health promotion interventions across the life course and in key settings. We're also going to look at the need for transformative action, particularly in cross-sectoral policies and practices that can really deliver on improved mental health and reduced inequities at a population level. The innovations that are required in policy development to support this, to create the supportive physical, social, economic and cultural environments that will promote mental health and well-being for all as a human right, and the investment that is needed in scaling up effective implementation of universal and targeted mental health promotion interventions globally. So these are the key themes that we will address. So having said that, I'm now going to hand over to my colleague, Dr. Miranda Novak, who will make the next presentation.
Thank you, Margaret. Thank you, everyone. I'm very excited that I have the opportunity to present. I'm coming from the University of Zagreb, Croatia, and I'm very glad to be the part of this global working group on mental health promotion. I'm actually dealing a lot with prevention research, but mental health promotion is my first love, and I try to contribute to the field as much as I can. Since I was listening to some other sessions, and I was seeing that there's a lot of going on, and people have said a lot about policy and advocacy. So I will just briefly address the definitions of advocacy and definitions of agenda setting. And then firstly, what my aim today is, I want to inspire you and call you to think about your local communities, think about your national or regional context, and how can you use our work as a spark or inspiration for the goals in your context. So we are actually talking about advocating mental health promotion, and we are thinking as a pandemic as a window of opportunity where mental health actually has come into the light and maybe probably should be the top of the investment priority. Since we need advocacy efforts, we actually need social actions that are designed to gain political commitment, policy support, social acceptance, and system support to actually address mental health promotion action, and maybe to affect some changes within the interventions, policy, and all other environments that support healthy living. So basically, if we we are seeing this work of the global working group, actually the work has been done with a collaboration of mental health and policy experts. And we have used some of the classic policy theories to inform the agenda setting process and to maybe build upon the framework that was already existing. We were working with Silton and Silton's work on physical activity advocacy coming from Australia. And we are proposing a framework that can be applied to mental health promotion. Silton actually asked three main questions in their framework. Why should we advocate for mental health promotion? What should be advocated? And how should advocacy be implemented? Leading on his work, he has 6 imperatives for effective advocacy. Here on this slide, you can see that those 6 components are evidence, policy fit, solution to the agenda, the strategy, key messages, and partnership. I will just briefly address the strategy now. Basically, the strategy has to be related with advocacy within the organization, with political advocacy within each of the countries involved, media advocacy, professional mobilization, and community mobilization, that are all the parts of the changing the narrative. And key message that we want to transfer, that mental health has to become a front and center of every country's response to the pandemic recovery, but as Margaret said, in the process of enhancing equity and ensuring the quality of life for all people. So what else is very useful for the whole debate? We anticipate that mental health will remain a concern in the public, and very important discussion regarding families, communities, school, workplaces, and that parents, children, adolescents, all of us will actually demand better mental health support and maybe even support within our workplaces. So that's again a window of opportunity. We should maybe learn to make better of use of that. Just briefly, I just want to address that there are differences in mental health promotion in countries where mental health is not on the agenda, and maybe in the high-income countries where already mental health policies exist. So maybe in countries where mental health is not on the agenda, but we still have to address stigma, publicly speak about mental health, maybe speak about determinants, and involve investments in stakeholders and in mental health. Whereas in countries where mental health is on the agenda, actually there we could maybe work on specific theme, which population should be in focus and how that can be of use. Also, it's very nice, very wise to use top-down approach and bottom-up approach, and we will give you some examples how that can be done. And there are different levels that have to be tackled regarding global and national investments. So we feel that there is an opportunity to leverage momentum, especially since the framework we have developed maybe inspire you all for your national goals and frameworks. And it is very important that maybe you work within your communities to find available national evidence for decline in population mental health, maybe to address relevant national and maybe international policy documents, map all relevant stakeholders, actors, and possible partners to strategize within 5 advocacy domains or on your national level, which will be addressed now. Silton says those can be media advocacy, professional mobilization, community mobilization, advocacy from within, and political advocacy. So some ideas we want to share. Maybe you can contact professional partners and make a coalition or a working group. Maybe plan a mental health promotion conference within your countries. Maybe you can invest your time to organize a petition for mental health organize a mental health day, local or national mental health weeks, festivals, or some kind of events. It would be very helpful to list organizations that would be willing to correspond with media as a coalition for this goal, and maybe to list and contact interested media and plan responses to media and conferences. It is very important to address political actors. Whom should you meet? Who could be interested in this theme? How politicians can be included? Who could be a speaker at a mental health conference? And how you can gain some momentum with that. Also, it's very wise that all included professionals commit to changes within their individual organizations, using some internal events, workplace programs, and boards to make mental health important. And in the following concluding slides, I just want to tackle some international opportunities. We all know that we have to use mental health ministerial summits. This year, they are happening in, it's happening in Italy. Also, there are new national, international opportunities related with UN Education Summit or Future Generation Summit. And also one important thing is that governments have to produce social development goals reviews for presentations on, within those summits. And we should engage as advocates to encourage governments to integrate mental health in their plans and hold them accountable for that. One important issue still is to tackle also opportunities within environmental meetings and include acknowledgements of the mental health impacts of the climate crisis and how that environment action can also pledge us to improvements in mental health, to assure positive resources for living and to deepen understanding of mental health. Thank you so much for the opportunity. I will now hand the microphone to Emily.
Thanks so much, Miranda. I'm just going to wait for control of my slides here. Great. All right, so hi everyone, and nice to be here today. My name is Emily Jenkins, and I'm joining you from Vancouver, British Columbia, Canada, where I live and work on the traditional, ancestral, and unceded territories of the Coast Salish peoples. In Canada, many of our Indigenous populations hold knowledge and engage in practices that have been passed across generations to promote wellness in ways that align with the principles of what we are referring to in our presentation today as mental health promotion. And yet the impacts of colonization continue to harm Indigenous peoples of Canada, restricting access to the determinants of good mental health. For my portion of today's presentation, I will be building on my colleagues' contributions to further discussions on mental health promotion advocacy. I'll be sharing an example from my research team where we have co-developed an intervention, Agenda Gap, to support youth-led policy advocacy to promote mental health for individuals, communities, and society as a whole. As my colleagues have illustrated, there's a pressing need for investment in mental health, including in mental health promotion, which is too often left out of the equation. To support this investment, there's a need for focused advocacy efforts aimed at informing mental health systems and infrastructure that attend to mental health promotion, prevention, treatment, and maintenance, or what some refer to as a population approach to mental health. The success of this advocacy likely depends in part on the volume and diversity of voices reflected and the inclusion of those with lived experience expertise. The United Nations Declaration on the Rights of Indigenous Peoples could be considered a helpful case in point. The development of this precedent-setting rights document involved the mobilization of Indigenous peoples from around the world who work together to demand a place at the table and have their voices heard at a global level. But how can efforts such as these be bolstered? how can organizations such as IUHPE leverage their membership to build capacity and momentum for policy advocacy? As Miranda has outlined, this is a question that the IUHPE Global Working Group on Mental Health Promotion has been grappling with in our efforts to generate a policy advocacy strategy for mental health promotion. In my work in Canada, my team has also been tackling similar questions, but with a focus on youth-led advocacy as a mental health promotion strategy. This is responsive to growing calls for the meaningful inclusion of youth, including by the WHO and UNICEF, who endorse young people's voices being at the center of policy decisions that impact their lives. And yet our team's environmental scan found that programming aimed at providing young people with the tools to have their voices heard and reflected in policy is extremely limited. This led us to co-develop with youth and communities an intervention that we call Agenda Gap, which is currently funded by the Public Health Agency of Canada and the Community Action Initiative. Agenda Gap is a social innovation guided by the science and practice of mental health promotion. It focuses on supporting young people to leverage policy advocacy as a tool to reduce structural barriers and guide resource allocation to benefit the mental health of individuals and communities. Agenda Gap aims to work in partnership with youth and adult allies, centering youth expertise to identify and mobilize policy advocacy and change. In essence, to bring youth voice to the agenda to create the conditions for good mental health. In doing so, it attends to the social and structural determinants of mental health and illness, as well as inequities or injustices that impact well-being. Agenda Gap involves a series of weekly engagement sessions held over approximately 6 months and facilitated by an adult and peer ally. The youth participants are between the ages of 15 and 25 and comprise various equity-deserving groups. At the heart of the Agenda Gap program is the development of supportive relationships between youth, their peers, and adult allies. Core topics aimed at building capacity for youth-led policy advocacy to promote mental health include mental health promotion literacy, social and structural determinants of mental health and equity, intersectional understandings of mental health, policy as a tool for change, using youth rights as a platform for policy advocacy, accessing and interpreting evidence to inform policy advocacy, influencing systems and system actors, and monitoring policy impacts. We've recently completed the first phase of the Agenda Gap, which has involved testing with 26 youth aged 15 to 25 who participated in one of 3 groups. 2 of the groups have completed the program, both in the province of British Columbia, Canada, and a 3rd group is underway in the province of Alberta. To bring this to life a bit, I'm going to share a couple of illustrative examples of the resulting youth-led policy advocacy. In one community, the outcome of this collaborative work was a policy dialogue hosted by the Agenda Gap youth. This dialogue engaged school and health authority policy and decision makers in strategizing actions to facilitate intergenerational mental health literacy programming to support youth mental health and to reduce high levels of cultural stigma related to mental health challenges. As a result of this advocacy, the local health authority commit to working with youth to create a model for intergenerational mental health dialogue. The school district has established a youth mental health committee and is supporting ongoing engagement of youth in school policy decision-making. In another community, Agenda Gap youth led policy advocacy aimed at strengthening the school board's anti-racism policy. This was in response to racism and its impacts being identified by these young people as a significant driver of adverse mental health outcomes in their community. The group prepared and delivered presentations to their teacher allies and school board trustees, where they made a number of recommendations grounded in lived experience and scientific evidence to improve anti-racism policies in schools, including through meaningful youth engagement. Alongside the Agenda Gap intervention, we have conducted a mixed methods realist evaluation to explore how the intervention works, for whom, and in what contexts. At present, data have been collected from our completed groups in British Columbia, which comprise 18 youth, as well as adult allies, policy, and other decision makers. Pre-post surveys and interviews were completed by all 18 youth collaborators, and 5 adult allies were interviewed. Although we're at the early stages of analysis, with our findings being largely thematic and not yet at the level of causal mechanisms, our data indicate that the agenda gap is associated with a variety of mental health promoting outcomes for youth participants, as well as ripple effects that hold the potential to address the determinants of mental health and equity in these young people's broader social contexts. For example, 92% of youth participants have rated the Agenda Gap program as excellent or good, and a variety of mental health promoting outcomes have been described. For instance, many participants shared that they had increased their knowledge and skills. One participant explained, "I have a much better understanding of how policy affects me and how it can affect youth mental health." Data also indicate that the intervention contributed to positive changes in behavior and coping. One participant shared, "No one talks about intergenerational mental health. And so if my forefathers or foremothers went through something, now I'm going through and I can approach it differently. Agenda Gap taught me to use that upstream approach. It gave me that proactive way of looking at my mental health." Many participants shared that the intervention contributed to their own protective factors, while also inspiring initiatives that will build protective factors within their broader social contexts. One participant recounted, "We started Agenda Gap around October. Later during the year at my school, we started a BIPOC club. Agenda Gap, I think, did have an influence on that because before, I didn't think we could have a space like this. So Agenda Gap was there, and some of the participants were like, this is cool. We should do something like this at school, and we did." For other participants, Agenda Gap played a powerful role in connection, a key mental health promoting factor. One participant offered, "It's the first place where I have adults or other students that I can openly talk to about my experiences or what is happening around us and not have to walk on eggshells. Because all the time in this group, I felt supported, I felt validated, and I was told things like, you're not alone. I was given ways to deal with. I didn't have people who would say these things to me before." Finally, the youth shared positive experiences that they associate with the youth-led design of the intervention and the ways it contributed to their feelings of self-efficacy and agency. One participant offered, "I felt like this was a really rare opportunity. It's something that's very new to be able to have a group of like-minded youth who are coming together. And especially that dialogue we did at the end. It was definitely facilitated by us. It was like they're listening to us." My hope in sharing this program with you today is to illustrate the power that can be leveraged through collective advocacy driven by communities. We have an opportunity right now as a global community to take action to improve how we respond to mental health. Together, we can use our shared wisdom to inform efforts to change mental health systems. We can encourage those in decision-making positions to adopt a population approach to mental health and to invest in mental health promotion as a key pillar of a comprehensive mental health strategy. So thank you for joining us today, and I'm going to hand over now to my colleague, Juliana.
Hello, everyone. It's a pleasure to be here today with my colleagues. I don't know if we are already in. Okay. Thank you for the support. Thanks. Well, it's a pleasure to be here with my colleagues again. My name is Juliana Fleury, and I'm joining you today from Rio de Janeiro, Brazil, where I live. I work as a volunteer CEO at ASEC Brazil, is a civil society organization based in São Paulo, and that since 2004, we do a pioneer work in the purpose of promoting children and adolescent mental health and emotional well-being in the school environment with evidence-based methodologies, and we are connected to 30 other countries. In 2018, we launched a coping skill movement to nurture the mental health ecosystem, as we have no players in Brazil, and we want to amplify our action towards different contexts beyond school to reach individuals, populations that in work environment and in society in general. And bringing this advocacy to our agenda, there is a lack of organization to address this issue. Yes, please, the next slide. Yeah, I control, sorry. I thought it was that. As my colleagues already raised during the sub-plenary, strengthening policy development and investment in mental health promotion is critical. It was before, but the response to the inequities exposed by COVID pandemic became crucial, especially in Brazil, that we have almost 50% of all the 12 South American countries population, that we are all together 437 million. And we face a social and economic challenges and gaps, not only in the service provision, but in literacy and in cultural aspects related to mental health promotion. So my contribution today is building on what my colleagues' presentation are posting, and consider opportunities of this momentum of policy developed in South America, bringing some of our experience here in Brazil, hoping to contribute to further discussions on mental health promotion advocacy. I will share some examples how we are working, that we advocate, but the key message I think we need to raise for South America is the investment need to address for the current population, and the needs to ensure this effective action will come for an intersectoral, cross-sectors action to mental health with equity and with evidence-based. So I bring some evidence-based that we had during pandemic, and this work of Dr. Danielle and Dr. Bruni results share with us that and illustrate that this questionnaire that was sent to mental health decision makers of ministries of health in the 10 of the 12 South American countries in mid-April 2020, these two key messages come that the strategies to meet mental health needs to rely heavily on timely and adequate responses to strengthen mental health governance and system, availability of service, virtual platforms, and appropriate capacity building for service providers. But also the long-term mental health reform entail strengthening legal frameworks that we are presenting here for the advocacy, distribution of financial resource, and collaboration with local and international partners. This means that we could not do something alone. We need to build together an agenda and actions for this. So we are bringing here in the sub-plenary a lot of provocative questions, and I add to my colleagues' questions is how each of us in IUHPE South Americans and international members could act to build capacity and boost this momentum for policy advocacy. I think we have a special challenge. I know that all countries are facing their challenges, but we need to build this despite our social panorama, because we have those contexts of socioeconomic inequalities that are really enormous. And sometimes what we are facing, for example, is that schools, for example, in Brazil, students are coming back to school after pandemic, and what they are facing is just academic struggling. And what happens is that they are getting more violent. They are having collective crises of anxiety, and this is something that we have to advocate for. That's important, not only to have academic. So that's why ASEC is since 2004 bringing this to the agenda. What I think I bring here to the sub-plenary is that two key issues that we could work to promote basis. The first one is to bring mental health to the agenda with no restriction. We live in countries that this mystification, we have normal taboo of talking about mental health in Latin America. And we have to embrace a national advocacy framework, the way Miranda present that our global working group is working. For us, everything is new in Brazil. I don't know, all the countries in Latin America, we are just starting with those frameworks. And the first legislation that is approaching suicide and mental health promotion prevention in schools is dated up to 2019. So it's almost before pandemic. We have no possibility that we have this regulation not implemented in the level of federal, states, and municipalities. So this is crucial. As Emily mentioned on her presentation before me, the success of this advocacy likely depends in part of the volume and diversity of voices. Give voices, reflect the inclusion of those that have lived experience. So putting this agenda of bringing discussions to the discussion, all the voices that are needed. So how can we build these efforts nationally and globally to make the advocacy strategy boost? Working together and act on different levels. So the policy advocacy within each of the countries, the media advocacy that I mentioned, the advocacy within organizations and corporate market, the professional mobilization, and the community, including these on educational. So for Latin America, this moment we have this open wing opportunity that I suggest three key investments: the awareness and demystification in general media, and I show you then an example. Build capacity and empowering the education environment with youth voices, and this agenda that that is the Global Compact Brazil, that an important role that could replicate in other countries, the ESG agenda. So the equity voices in mental health agenda in all of these three issues are essential. Here in Latin America, we have the media that works towards violence. So I think to have positive mental health on this agenda and literacy journalists and the media in general to talk positive and raise issues, examples, not only the crises that are beyond sometimes of our control, but bring examples. We are now mentioned on this media. The other example that we are living here is on this call for action for youth. We are just starting the translation of the UNICEF protocol and the youth guide of advocacy. This is really key for youth participation and engaging other countries together. So we since the beginning of the pandemic, we started doing a lot of youth literacy and empowerment, and we have some initiatives that put them in the center of this initiative, and they started having their voices. But the first step is giving them literacy and empower them to advocate for themselves, for having them on policy decisions that impact their lives, and have this good mental health promoted. And the other issues is the Global Compact. It's a call for action. We have to work together with the companies and try to bring them here in Brazil. We just started a new action to have them together and united act for delivering service and connected to the GSD, the health and well-being. So how to promote a global disruptive advocacy to guarantee what we mentioned at the start that Margaret said, the transformative innovation and bring investment. So in all levels, we need these voices to be heard, new approaches to find new equity ways to act. The innovation is moving from ideas that goes with this diversity and make feasible by this cross-sector and intersectoral connections, because only we that represent civil social organization, we are at all levels interacting with government, with multilateral organisms. So this is key for us to get together and make this agenda feasible. So we believe that united force with policy as a tool change, we can go from dependency to autonomy. This is the contribution that I hope to bring to you today, and I hope to meet the group from South America later on, with Orla. We have a network meeting and hope to bring more people to this agenda to work together in South America. Thank you for the opportunity. And I now pass to Margaret, I think, that because the next two are recorded messages. Thank you.
Great. Thank you very much, Juliana. And thanks also to Emily and Miranda for their presentations. Just a reminder to people who are joining in, if you have any comments or you would like to make on anything you've heard so far or engage in the discussion, please put your comments or questions into the Q&A and we'll pick them up and open up the discussion at the end. So next, we would like to go to the presentation from Irene Verins. Irene works as a program lead with Beyondblue in Australia. So if we could please get that recording up, please, ready to go.
Hi, my name's Irene Verins and I am the Wellness and Prevention Lead at Beyondblue, one of Australia's largest mental health organisations. Prior to this, I was the Manager of Mental Wellbeing at the Victorian Health Promotion Foundation, otherwise known as Vic Health in Australia, and it is from here that I will consider the contribution to mental health promotion made by wellbeing. I'll also look at the tools and enablers of transformative practice and provide a case example. But first, I'd like to acknowledge the traditional owners of the lands upon which I present this discussion today, the Wurundjeri peoples of the Eastern Kulin Nations in Australia. I pay my respects to their elders, past and present, and any other First Nations elders present today. Large-scale disruptions and demographic changes and social trends have impacted our mental health directly, but also, and more importantly, our view of what mental health is and how we see it, how we experience it. These new ways of seeing mental health require transformative approaches and new perspectives to optimise mental health promotion. In Australia, there have been a number of significant developments in the mental health policy arena that have created new conversations and approaches. One of these is the adoption of wellbeing as it relates to mental health. Numerous recent Australian government mental health inquiries have adopted the concept of wellbeing and added it to mental health, signalling a wider focus on both the absence of mental illness and on creating conditions in which people are supported to achieve their potential. The Australian National Mental Health Commission's Contributing Life framework focuses on thriving, not just surviving. It has equity and human rights at its centre and acknowledges that maintaining connections with family, friends, community and culture, feeling safe, stable and secure are essential platforms for mental health. The outcomes of this are new approaches to mental health and wellbeing, including accountability across government portfolios, more inclusive environments, more empowered individuals and communities, and less stigmatising perspectives on mental health. A great example of how wellbeing has shifted the conversation in mental health and highlighted a focus on social determinants of mental health is this National Children's Mental Health and Wellbeing Strategy. It provides the framework and foundations for lifelong mental health and wellbeing to be built during childhood with a whole of community approach. It is informed by a human rights, equity and inclusive lens. The strategy seeks to create a new shared understanding of the roles of families, communities, services and educators in promoting and supporting child mental health and wellbeing. It's been developed with invaluable input from a diverse range of children and young people alongside their parents and carers. Active consideration has been given to the diversity of environments within which children live, and this has seen the Commission engage with and listen to those who are working with children and their families in educational settings, juvenile justice, the out-of-home care system and the health system. The insights of those living and working in rural and remote and Aboriginal and Torres Strait Islander communities are key components of this strategy. The strategy promotes a wellbeing continuum, as seen in this PowerPoint, highlighting that there are opportunities to improve wellbeing and possibly intervene before a child gets sick. It importantly shifts the focus away from narrow, medicalised and stigmatising understandings of mental health towards capturing a full range of the child's emotional and behavioural experiences. It also focuses on a child's functioning rather than diagnosis. It includes concept of thriving, reflecting not only the absence of psychological or behavioural problems, but also the presence of strengths and wellbeing. In the children's strategy, they talk about using a wellbeing continuum to describe the full range of mental health and wellbeing. This is a continuing scale from well to unwell that shows that we all have mental health and our mental health can change over time. Now, children and young people are active members of communities and experts in their own lives. All children and young people should have a voice in identifying problems and finding solutions that impact their health and wellbeing. As a case example today, this next initiative creates partnerships, training modules and communities of practice that provide best practice and evidence-based strategies for local government or councils to ensure children and young people are at the centre of the design, delivery and governance of initiatives that aim to improve their health and wellbeing. Firstly, VicHealth developed partnerships with councils to address factors that directly impact the lives of children and young people. These health promotion modules or toolkits, known as Leading the Way, provide practical guidance, how-to guides for taking action and links to additional resources, templates and case studies. VicHealth's local government partnership model has a strong emphasis on building capacity within councils to authentically engage with children and young people and use systems thinking approaches to guide the development, prioritisation and implementation of actions. This is all to inform the planning and implementation of health policy and practice change for councils, which must develop 4-year municipal public health and wellbeing plans. They are a key lever in enabling councils to provide children and young people with opportunities that give them the best start in life. These modules, as part of Leading the Way, are designed to provide the options to choose the recommended activities that best suit the council, the community size, and the starting point, how much capacity there really is, ensuring that you can make an impact within your community, whether you are a large or a small community or council. As you can see, there is a light touch quick wins module, which is about the establishment of a youth advisory group, which won't take an awful lot of time or resource, but is still incredibly important. The step up is a collaboration through a youth advisory group with actions or a program attached. The ambitious one is a youth-led policy co-design with council. And as you can see, it certainly takes a lot longer to be embedded properly in a system. Now, because mental health stretches beyond a single system, partnership development across multiple sectors and organisations is an essential skill set. If partnerships are to be successful, however, they must have a clear purpose, add value to the work of the partners, and be carefully planned and monitored. This resource, the Partnerships Analysis Tool, is for organisations entering into or working in a partnership to assess, monitor, and maximise its ongoing effectiveness. It is designed to help organisations deliver a clearer understanding of the range of purposes and of their collaborations. It's also designed to reflect on the partnerships they have established and focus on ways to strengthen new and existing partnerships by engaging in discussion and reflection about issues and ways forward. And finally, communities of practice are also a notable feature of VicHealth's local government partnership. They are critical in providing fast-track councils with both peer-to-peer and expert partner support during the implementation of the health promotion modules. Communities of practice will be facilitated by partners, including leading Victorian universities, people from council, and key agencies and peak bodies with specialist industry knowledge. As well as offering practical and strategic guidance to councils, they will foster collaboration and the sharing of case studies, ideas, knowledge, and learnings. All of the initiatives that I have provided to you today are available and online from the VicHealth website, and I welcome you all to certainly avail yourself of those resources. I hope they will be useful to you. Thank you very much.
Great. Thank you very much, Irene, for that excellent presentation. Really great to hear about all that work that's going on in Australia. We'll move now to our next presentation, which is from Janet Fanslow from the University of Auckland in New Zealand. And Janet has also recorded her presentation for us, so if we could please present that now. Thank you.
Tēnā koutou, tēnā koutou, tēnā koutou katoa. My name is Janet Fanslow. I'm coming to you from the University of Auckland in Auckland, New Zealand. And I'm really picking up on many of the themes that my colleagues have already introduced. This idea of building a community of practice for mental health promoters, advocating for mental health promotion, thinking about mental health promotion for particular groups, which is based firmly on the idea that we have the people with the capacities and skills necessary for doing that mental health promotion work. And it's that knowledge from our colleagues, but also really the knowledge that we're getting increasingly from around the planet, around the recognition that people are ready for a change, about ready for dealing with the issues of racial disparity that we're grappling with around the planet. People are ready for a change around dealing with issues around sexual violence and other forms of assault. People are ready for grappling with issues around gender inequality and ready for talking about and changing some of the issues that we have around economic disparities within the population. And people are ready for dealing with issues around Indigenous rights and understanding that we need to grapple with those issues as part of coping with the planetary issues that we're all facing. And so within that backdrop, we're coming to this session with the idea of really thinking that mental health promotion does have something to offer all of these issues. And that if we're going to get a mental health promotion workforce that can help us address it, we really do need a common understanding about what are the skills and abilities that people need to take us forward about tackling these problems. So mental health promotion, of course, does not exist in a vacuum. It sits within that wider foundation of health promotion work already so well articulated for us by the IUHPE accreditation system for health promoters. So we weren't trying to recreate that platform, but really trying to focus in on saying what are the unique knowledge that is important for mental health promoters to have as an individual or as part of a mental health promotion team to move us forward. And it's within that that we went through quite an extensive process about trying to get a shared understanding of what those mental health promotion knowledge competencies might be. So we really did look across the planet in terms of other places that had done very well articulated thinking about mental health promotion competencies, from Finland to Canada to England, as well as across the global working group for mental health promotion, to have those conversations about what we thought mental health promoters needed to know. And through that, we came to this articulation around the mental health promotion knowledge competencies, which is a document which is now available and which we're pleased to be able to share with you briefly through this conference. And within that, to understand that mental health promoters do come with some unique knowledge bases, partly just about thinking about mental health in the positive sense. Actually, it's more than just the absence of mental illness. It is people who are thriving, people who are flourishing, people who are doing well emotionally and psychologically, but also doing well in relation to other people. And understanding that at a deep level in terms of understanding how that is so deeply connected to issues around social justice and tackling issues of inequality. And mental health promoters also need particular knowledge bases around determinants of mental health and what are actually some of the core things that we might wish to focus on to really achieve some of the sea change that we're looking for in terms of developing mentally healthier populations, issues around tackling discrimination, issues around promoting social inclusion, determinants around elimination of violence, or better, the promotion of healthy relationships. And the understanding that focusing on those determinants will get us where we're going because we're going to be focusing on the right things. Understanding that mental health promotion is never created in a vacuum. It's created very strongly in terms of understanding the different social and cultural contexts that people come from and working to co-create with them their vision of what mental health and happiness looks like for their tribe, for their crew. It's also helping articulating knowledge competencies for mental health promoters also has value because it helps to give us a shared structure of theories and models that can help people tailor their actions in ways that are more strategic and that are more effective in terms of thinking through what are the important levers to pull around advocacy and partnership to move groups of people toward mental health, and to understand about how we can move across and support people in their mental health, both across a life course, but by working in areas other than health, around social different sectors, and from that social ecological perspective. Mental health promoters as a team also do need that evidence base and the research knowledge about how we use research to inform and the evidence to underpin what we do, so we know we're working on things that are most effective. And that once we have that evidence of effectiveness, that we connect in with the systems and the policies that will help us move things for whole groups of people. And mental health promoters with the knowledge and communication skills to get those messages across to help us move forward. So now that we've got to the point of having those mental health knowledge competencies articulated, we are really at the stage of being keen to share those with others, being keen to share them with you as conference participants, but also with the wider developing mental health community of practice. And using those to say, now that we have a shared articulation of those knowledge competencies, how can we work with those organizations like universities or other education providers or key communities and organizations who are responsible and, you know, can help support the growth and the renewal of mental health promotion as an area of practice, and really get it known as an area where there is value in investing your time and energy, and in terms of, you know, hiring and employing and working with people who have the skill sets that will move us forward. So we're looking forward to working with you from the base that you're coming from, but also in terms of thinking about how we can leverage that knowledge and understanding across national and international bodies. So if you're interested in finding out more about what's been happening with the Global Working Group on Mental Health Promotion, or accessing the document on knowledge competencies, please do visit the website, which will be an important source of information about the wider platform of work. But if you want to know more about the knowledge, mental health promotion knowledge competencies, do feel free to contact me. I'll finish by thanking my colleagues and co-presenters on this, and I know you'll have a lively discussion going forward. Thank you.
Great. So thanks to all my colleagues from the Global Working Group for a great set of presentations. Now we have, I'm just checking with Miranda, but I don't think we seem to have any questions or comments online yet, but we're very happy to receive any comments that you have and to engage. In the presentations, we've discussed a wide range of issues, and we're really keen to hear from your experiences in your country about how mental health promotion can be put on the policy agenda and put it on in a new way and developed. So please do put in any comments into the Q&A so we can pick up on that. While we're waiting for you to engage and come in and hear from you, maybe I can just go through. I mean, Miranda started by talking about advocacy and at a national level, and trying to really mobilize support for mental health promotion. And it's difficult because quite often in the field of mental health, the focus is very much on mental ill health and on treatment, which of course is very much underfunded, under-resourced. And so shifting the agenda to think more upstream about how we keep individuals and populations mentally healthy, you know, it requires some additional, it requires a shift really in terms of that. So Miranda's with us, but I understand that there's a problem with the camera, but she's here, and so she can talk and we can hear her. So Miranda,
yes, I'm here.
Great. If you might speak a little bit, you know, so since the pandemic, for example, have you seen in your own country of Croatia that the kind of a population level approach has become more visible?
Yes, there were a lot of positive changes, I would say, during last year or so, especially Ministry of Education did a lot of presentations, collecting various experts that are investigating mental health, that are investing in compassion, in evidence-based interventions. They offered a lot of support to schools, to children in schools, to parents, and I think even, you know, very little things. There were mental health experts coming up on media, giving some advice how to, you know, survive the pandemics, how to invest in your everyday mental health, how to probably deal with stress, which is normal. We also had two very massive earthquakes, one in 2020 and then the next one just a year afterwards. One was in Zagreb, one was in in smaller area, 100 kilometers surrounding Zagreb. So basically people were really starting to notice that, you know, homeschooling children, being cut off from social contacts, being away from work, working remotely, they started, you know, to feel the everyday lack of quality and actually needed some positive resources for living. Also, I would maybe stress, I wouldn't say that mental health promotion is on the agenda in Croatia. And even treatment is not in the focus at all. But during just a month ago, there was a big development. For example, there was no strategy on mental health, national strategy on mental health from 2016. And now we had public debate on mental health and that was pushed. So this is a great investment. So I think that also conferences, scientific conferences were also related to well-being, quality of life, and I can see that even during next 6 months there are some national developments in that direction. So yeah, for someone being in the field, I think that things are changing a bit. Yeah,
that's great. That's good to hear about. In my own country, in Ireland, we had, before the pandemic, we had started work on a national mental health promotion strategy, and work on that continued. So now we have a strategy for mental health promotion within our National Health Service, and that was launched just in April of this year. So that's really good. But now, and also our Department of Health is now working on an intersectoral national strategy for mental health promotion. So this is this will really give a real mandate for action. So that's really important. So I see we have a comment in from Margaret McClune, who I know is also from Ireland. So Margaret says, thanks for the really interesting talks. Is the last document available publicly? So the last document was the one on the competencies for mental health promotion. And yes, that document will be it's just recently produced. It's hot off the press. So it will be available on the IUHPE website, where it can be downloaded. And I think, you know, that Janet presented on it there, it's really kind of articulating what are the kind of new skills and new types of knowledge that we need to have practitioners who can bring together the kind of public health approach and the mental health expertise, bringing it into mental health promotion. Okay, so please do, you know, share with us examples of what's happening in your country, or indeed, like Miranda's talked about, the opportunities that there are there now to really kind of push and to advocate for greater investment in this area. Emily, maybe I could come to you. In your presentation, you gave us some great examples there of a youth-led advocacy approach, and it was really interesting to see how that kind of process also kind of address the kind of structural determinants of mental health, you know, looking at the anti-racism policy in schools. So, you know, maybe if you could just say something about that. And the second thing I was struck by as well was the intergenerational component. I think that was really lovely, because while we often focus very much on young people around mental health promotion, I think older adults often get lost out of the picture. And when we think of the possibility that there is for exchange and that sharing of the wisdom, and also, between young people and old people. So maybe, would you kind of maybe talk a little bit to both of those, if you don't mind?
Yeah, thank you, Margaret. So in terms of addressing the structural determinants of mental health, what we're really trying to do with Agenda Gap is to build mental health promotion literacy. And so what we mean by that is really bringing to the center the ideas of equity, of human rights, and specifically youth rights, and so that young people have that knowledge background to be able to bring forward these new understandings about mental health as a positive and strengths-based experience that everyone has, and that we can further strengthen and build. And the intergenerational piece really came up in response to the culturally driven stigma that was very strong in this particular community of young people, where many of them were first generation newcomers to Canada. And so their particular experience was kind of situated within this context where there was this very strong stigma. And what they relayed to us was that mental health promotion as an orientation really had the strong potential to be able to break down some of those barriers that exist for them, in the sense that that strengths-based orientation provided opportunities to start new discussions, and ones that maybe weren't so stigma laden. And so recognizing that those connections and those relationships are so important to mental health throughout the life course, they were really trying to catalyze opportunities to bring forward, break down barriers and bring forward opportunities to build those relationships further. Margaret, I was wondering if I could maybe follow up with a quick question for you regarding the mental health promotion, the national strategy that you've managed to help lead for Ireland. And, I guess reflecting on the various discussions that we've been having within our group today around, where a mental health strategy is in our various countries, it appears like Ireland has made some great strides, and I'm sure you are at the a key factor in accomplishing that. But I'm wondering if you could share a bit of your wisdom around how it was possible to bring that kind of upstream orientation to mental health policy in your context.
Yeah, thanks, Emily, for that question. I mean, I think, in advocacy terms, things don't happen overnight. And I think, there was I suppose, a small group of people from practice, from academia, from policy, who over the last 20 years have really been sort of pushing the agenda, advocating for this. And certainly in our national mental health strategy, initially we had promotion, prevention, treatment and recovery, just very much following the WHO model. But of course, often these strategies, when it comes to implementation, they're under-resourced, and the promotion piece can fall off, the prevention piece as well. So there was a continued kind of push, I think, and very much it came from within our health promotion colleagues, actually. So our colleagues working within health and well-being, who were pushing to really get a kind of standalone mental health promotion focus. For the reasons I was saying, it's often that the whole discourse can be dominated by mental ill health, because there's a great need to improve services and do everything, but to really shift it towards how do we keep people and individuals healthy, how do we ensure that that is there. So it came from within health promotion. And that momentum has been building, and the work did start before the pandemic, but certainly I think anybody that wasn't convinced before the pandemic are certainly more convinced now. So it was very much a kind of a collective effort of people pushing from different directions. You know, from academia, we were able to bring in the evidence, we were able to bring in the other international developments, the practitioners were able to bring in, look, yes, we can do this. We're already doing quite a lot of it. You know what I mean? It's about embedding it within our existing implementation systems, and it's about getting our existing staff trained up to do this and make it work. So I think that that was kind of key in terms of that. And, you know, colleagues like Anne Sheridan, Orla Walsh, you know, within the service working, and then colleagues within policy as well. Okay, and that document is actually publicly available now as well. So that's there on the Health Service Executive website. Juliana, I wanted to come to you as well. You know, you talked about, you know, the opportunities that are there now in Brazil in terms of the recent developments, and you spoke a lot about the youth empowerment and engagement. And you also mentioned the ESG agenda. Would you like to just maybe say a little bit more about that?
Yeah, it's a pleasure to bring and raise this. As I mentioned, everything is very new. UNICEF just brought us this opportunity with the pandemic to engage more youth. And we used to work a lot of professionals within education and health, mental health service. But then we started working straight with youth and bringing them to this center. So this building competences on them and in the network itself with these professionals are really bringing a new context in Brazil with the youth. But in the same way, the pandemic brought this opportunity for the ESG that we are facing, I think, globally as an opportunity, because the agenda to 2030 is calling us for actions and make some transformative initiatives to be better into 2030. Not only the children, adolescents, but within corporations, with populations in general. So we face this as opportunity, and not only that we are looking to Brazil, but I think as mental health is well, just to 2020 got this space on the agenda in the GSD 3, the health and well-being. I think this is an opportunity to, as Miranda said, environmental issues and mental health, we need to get this space. And I think we have a tremendous opportunity, not only in Brazil, but all around the world.
Great, thank you very much, Juliana. We had another comment in which asks about, from a bottom-up point of view, what about mental health promotion and health practitioners' compliance in research? I hope I'm interpreting this correctly. So if I'm not, please just kind of put some more detail into the Q&A. But I think, I mean, we have a growing body of evidence around mental health promotion. And certainly in terms of our strategies and the position statement, that it builds on the existing evidence. And we do know that when we promote mental health effectively, not only does it lead to improved mental health, it also leads to improvements in a range of health and social well-being functions. And we have good evidence of that from across high, middle and low income countries. So I think if you mean compliance in that sense, are we informed by the research? Absolutely. Because we want to make sure that what we're doing is adding benefit and is leading to those kind of positive and equitable outcomes. There are gaps in the research for sure, and we need more information, certainly around the implementation research piece. And we also need more about, working across very diverse settings, low resource settings, about, making mental health promotion work on the ground. So I hope I've answered your question, but if I haven't, please just come in and explain it, or just ask it in another way or whatever, just in case I've misinterpreted that. Okay, so we have just a few minutes left in this session. So if any of you have any comments or would like to share any experience, please just type in on the Q&A. In the other two presentations, I was just struck in Irene Verins and her presentation from Australia, and she talked about the positioning of mental health promotion within the well-being continuum, and I think that's very interesting as well, because I think, you know, we now have the publication of the Geneva Charter for well-being, and it very much embraces, like, in the well-being at the individual, at the societal level. And there is no doubt, I think, that mental well-being is a very critical lens through which to see societal well-being. Like, we can see that during the pandemic, you know, the mental well-being was severely impacted. Because societies were impacted, and that mental well-being, how one feels, how we feel about our lives, our future, the future of our families, and this is at our core in terms of well-being. So I think that the well-being agenda, which is now gathering momentum in a number of countries, I think is very important that the mental well-being component of that is made very explicit, and of course it's so interconnected with the others. Miranda, you touched briefly as well on the, I suppose, the link between mental well-being and planetary well-being, and how the climate crisis particularly impacting around youth mental health. And I don't know whether you'd like to say something on that.
Well, we are just starting some research within youth population regarding that, but as we saw a lot of global traumatic events, and even those earthquakes here, it came across a lot that youth are reporting anxiety regarding the environmental future, even anxiety regarding the, you know, the how world is going to look if they're worried about having children in this kind of environment. They are talking about a lot of issues regarding even dietary aspects. Orthorexia is coming as something really important related with mental health and also climate conditions. So I think those opportunities are really coming in, and we have to tackle that, because it's not something that can be seen in population that is clinical. I think it's like everyday thoughts of youth, because they are really facing that environmental changes that are really abruptly in focus.
Great, thanks for that, Miranda. There's another comment in here from Jacopo Villani, and who states that the Irish mental health promotion strategy, besides focusing at a population level, it includes actions for at-risk groups such as Irish travellers who are a nomadic group, which provides us healthcare practitioners with more ammunition to focus on promotion. And thanks, Jacopo, for that comment. And I do think, you know, the idea of having that strategy, it gives a mandate for action. You know, and it gives a mandate for action for focusing with priority population groups, and that is certainly there. And of course, with the mandate for action, we need to make sure that we have the capacity for action. And that is what Janet picked up in her presentation around having the right mix of skills and competencies for mental health promotion, because I think it draws on a wide base to make sure that we have the partnership skills for the intersectoral action. Emily and Juliana, I just wonder if either of you would like to comment on that issue of the capacity, either from a country perspective or a personal perspective.
Oh, I would like to add to Miranda's comments, because here in Brazil, we have a lot of rain disasters. And what is seen, we were reached by a foundation that wants to work with this community to try to build coping skills, because this happens 10 years ago. And then we worked with this community, with ZIP's friends, with all methodologies. And now the adolescents is living the same problem. And then we have another opportunity. Is a sad situation, but this brings awareness for the foundation, for the institute, for the whole sector. As I said, this crisis, environmental crisis, is something that we have to advocate, that we have to work with this mental health with an environmental crisis together. That's I think this is a really issue to work on.
I mean, it really shows how all the determinants are so interconnected, you know, and that they impact so much on the mental health and well-being. Emily, any final words from you?
I just think, Margaret, that interconnectedness is why we need to really be having mental health promotion as a key pillar of our mental health strategies, you know, locally and globally. If we don't get away from the focus on acute care and crisis, then we're really not having the opportunity to attend to those interrelated social and structural determinants that so heavily shape our mental health and illness experiences. So thank you for the opportunity to bring those forward here.
Yeah, and I think now is certainly the time to make that shift. I mean, all of you have highlighted there really is an opportunity now to do that. And I saw we all have to grasp that. Okay, so I can see the clock is ticking down, and so I just really would like to thank my colleagues from the Global Working Group on Mental Health Promotion. My thanks to Miranda Novak, to Emily Jenkins, to Juliana Fleury, to Irene Verins, and to Janet Fanslow for your all great presentations today. And thanks to all of you who joined in to this session, and those of you who made comments. And if you want to find out more about the work of the Global Working Group, you can find further details on the IUHPE website. So we'll just say goodbye for now and wish you all well. Thank you.